This is your host, Dr. Aftab Ahmed, with the program Innovative Pakistan with Dr. Aftab. And today we are going to discuss a very, very important topic, and that is about the blood transfusion. So, today we'll discuss in detail about blood transfusion scenario in Pakistan. What are the issues, challenges, solutions, and opportunities? And to discuss this topic, we have a very renowned scientist with us, Professor Dr. Hassan Abbas Zaheer. He has served at different positions. Currently, he is serving as advisor to WHO on blood transfusion and blood safety. So he is the very relevant person to talk on this very important topic. So we are thankful to Dr. Zaheer for joining us today in the studio. And let's begin our discussion. So we are actually in the format of our program. We initially ask our guests to give us your educational journey, so we can like inspire the people, like those people who are serving at the key position, so they our listener could understand their own educational journey, and that could be an inspiration for them. So we start with the educational journey, and then we will talk more about your career, and finally we'll come to the topic.
Thank you very much for your invitation, first of all. I am a medical graduate and I graduated from Rawalpindi Medical College very, very long time ago. And then I did my house job, and after completing my house job, I joined Pakistan Institute of Medical Sciences, worked there for a couple of years, and then I went abroad to London. I got admission in University of London for my PhD in hematology.
Wow.
And I completed my PhD in hematology and came back again and served, rejoined the Pakistan Institute of Medical Sciences in the Department of Pathology as Assistant Professor Hematology.
Okay, nice.
And then I worked there for a while, and then from there on, I over a period of time, I transitioned into various fields of hematology, like from main diagnostic hematology. I later on shifted to transfusion medicine in the same hospital, and then from there into these vertical health programs managed by the Ministry of Health, and in between I also rejoined PIMS, and that's how I progressed during my career.
Okay, very nice. So your journey is very interesting. Starting your journey in Rawalpindi Medical University, joining PIMS, and then what was like your motivation at that time? Mostly people, like those who were the young graduates, they mostly go for SCPS. There is like I hardly seen long ago like person who is going from medical degree to PhD. So what was your motivation like, and at that time, long ago, like going to UK for a PhD degree?
I don't really think it was motivation. That came later, much further down the line. But basically, I was in pathology, which is considered as a basic science. It's also now a clinical field, but lab diagnostic work is still considered as a basic science. And so in this basic sciences, you have MPhil and PhDs, and I had an opportunity to go to London and got admission in University of London. I was based in St. George's Hospital in London, and there I did my research project, and that's why I was...
So how back was it then?
This was early 90s.
Oh wow!
Early
So
90s.
this is like long ago. So what was the scenario in Pakistan? Like you was working here in hospital in PIMS. That's one of the best hospital in Pakistan, and then you was doing your research in London. So back then, what was the difference in research and kind of facilities back like in London and back in Pakistan?
There's no comparison, basically. I mean, UK is a very advanced country, while the health sector in Pakistan at that time was not very well advanced at all. Now it's different. In the public sector, there's still many gaps and issues, but in the private sector, and there are islands within the public sector also where they have excellent centers and facilities. But PIMS was a very large hospital, no doubt, but there were always resource constraints and huge work overload, which was completely disproportionate to the facilities available. So it was very challenging to work in PIMS and also a bit frustrating. So after a while, I, I made a lateral shift within PIMS and within the pathology department towards transfusion medicine. I thought there were a lot of things that could be done to fix the blood banking system in PIMS and the country as well at that time and still. So after a few years, I made this shift to blood transfusion, and from there, at that time, this was early 2000. There was an opportunity from the government of Germany, federal government of Germany, to invest in the blood banking system, basically to prevent HIV and other transfusion transmissible infections. So for a few years, the Germans made this offer to the health ministry in Pakistan, and the health ministry entrusted this responsibility of utilizing this funding opportunity to the National AIDS Control Program.
Right.
Because that was the only platform in the health ministry which had anything to do with blood transfusion, and this was also very little. All they were doing in the AIDS program was that they were providing some screening kits to the blood banks in the country. So there was this excellent opportunity to fix or improve the blood banking system in Pakistan. But the health ministry and the AIDS program were clueless how to utilize this opportunity.
Right.
So over a period of 4, 5, 6 years, various German experts would come to Pakistan, interact with the health ministry and the provincial health departments and the experts to try to figure out the way forward, how to go about it. And I would also be invited in these interactions, seminars, workshops, and national consultations.
Right.
It became very obvious to me very soon that no one had a clue how to avail this opportunity. And to me, it looked like a very simple, straightforward solution that the existing fragmented blood transfusion system in the country at that time was not sustainable, and it was beyond repair. And so investing any more time, money, and effort in a system which is no good, it's a waste of time. So I proposed, but no one really paid much attention to it, that we need to have a nationally coordinated blood transfusion system like in the other developed countries. And that system is a very simple system where only one organization is responsible for ensuring safe blood transfusion to everyone in the country.
Right.
In many countries, this responsibility is taken up by the government itself. In many other countries, the Red Cross or the Red Crescent Society is entrusted this role. So both the models are fine because there is one entity responsible. In contrast, in Pakistan, any Tom, Dick, and Harry, if they feel like it, they could have just gone out, bought a shop or rented a shop and started blood banking. And there was no regulatory control, and you can do just about anything and make a lot of money. And some people may get their lives saved, others may get infected or many other problems. So it was completely unregulated, and I thought that, we need to adopt the Western model, which is the internationally recommended model.
Right.
But I couldn't do much about it because I was not in a position of authority. I was just representing one of the blood banks, public sector blood banks in Pakistan. So later on, sometime later, I got the position of the national manager of the AIDS control program was advertised, and I applied for this position. My main inspiration, this inspiration thing is now coming into play. My main inspiration was that this project or this funding offer is lying there in this program, AIDS program, for a very long time, and they are clueless about it. So if I can get this role of national manager of the National AIDS Control Program, I can do something to avail this funding offer. So I applied for this position, and it's a long story, but I got selected for this position, and I was asked to join immediately, same day, So I joined, and in addition to taking up the role of managing the national response for HIV prevention, I also started working on reviving this German government funding offer for improving blood banking system in the country. And during this time, if you remember, we had a very big earthquake in 2005, I think, and the Germans had diverted the funds for this project to earthquake, but I managed to convince the Germans, and with the help of the health ministry at that time, we got the funds back where they should have been, and we started working on advocacy for developing a national blood program. We had to struggle a lot to convince the health ministry and the health departments and the stakeholders and the German government, and we came up with a program which was finally, we achieved consensus on having this nationally coordinated blood program like the rest of the world, and we made PC1s for that. We knew devolution was coming, so we had to make separate PC1s for all the provinces and the federal area and all. So it was a long journey, long work. It took almost 2 years, but we finally managed to not only prepare these PC1s, but also got them approved from the provinces and at the federal level. And the Germans fully supported us, and also WHO was supporting it by providing valuable technical assistance. So this was final approval came about in March 2010. By that time, I had completed more than 2.5 years in the AIDS control program and did a lot of work there also, and found it very interesting. Also got the opportunity to travel all over the world, which was also very interesting and very motivating. And so once we got this approval for the program at the federal level, which means that in addition to the German funding, a matching funding allocation by the federal government and the provincial governments was also committed. And so at that stage, the health ministry decided to take the blood sector out of the confines of the National AIDS program and notify it as a separate vertical health program.
Right.
And that was the right thing to do, because blood safety program should not be in a program which is about a disease.
Yeah,
so this
so
is
that's just one disease, and there are so many other diseases that
Yes.
also. So it should be like holistic rather than for a single
Absolutely.
disease. So I think that was a great move. So we just actually wanted to learn more about this safe blood transfusion program which she was leading. So what impact it has created? So what you have just mentioned, that the scenario was not really good before, because any like body can open a blood bank and was doing the transfusion that were resulting in so many diseases. So what you have done in that program and what impact it has created?
Yes, and I would just add also that in addition to notifying the new program, they also notified me as the first manager of the Safe Blood Transfusion Program.
Okay.
So my role was to mobilize all the partners and work towards establishing a new reformed blood transfusion system in the country, which basically entailed the establishment of really construction from scratch of customized large regional blood centers in different parts of the country, where and along with the regional blood center construction, we also renovated existing hospital-based blood banks, which were already functioning in the hospitals. So at that time, what was happening in all these hospital blood banks, these would be invariably small blood banks, 2-3 rooms blood bank, and they would be doing all the work in these small facilities, which includes mobilizing voluntary donors, mobilizing family donors, collecting blood from them, preparing or not preparing blood components, screening, testing, processing, and then providing blood components or whole blood to the patients in the hospital for transfusion.
Right.
So this work was being done in all the hospitals. So if in Islamabad there are 20 hospitals, you would have 20 small blood banks.
Right.
And this is stupid. In a city like Islamabad, you don't need to have screening systems and all the other storage facilities and everything else in each blood bank.
Right.
What you need is one large regional blood center, which would be responsible for blood production, basically, which means collecting blood, storing, processing, making blood components, and storing it, and then providing the prepared blood components to the hospital blood banks.
Right.
And that's why we upgraded and renovated the hospital blood banks. So we made functional separation between production of blood, which would take place at the regional blood centers, which are the new centers, and utilization of blood, which is in the existing hospital-based blood banks.
Right.
So we started work on the construction of these new blood banks, which was not an easy task because you have to get land for it, and funds were allocated, but getting land and suitable land and all that was not easy. But anyway, we made 10 regional blood centers all over the country in all the provinces, and at the same time we upgraded, we linked 6 hospital blood banks to each regional blood center.
Okay.
So 10 regional blood centers and 10 regional blood centers were developed from scratch, and 60 blood banks were upgraded.
Right.
So this was the infrastructure development in the first phase. On the one hand, we started work on this dimension and direction, and at the same time we started the technical work, because having a new shining infrastructure with new shining machinery, and this was all being funded by the Germans. So it's not good to have all these new toys and new buildings if you are going to practice the same bad practices,
Right.
and the same untrained people, or same practices and same habits and everything, poor laboratory practices in the same in the new infrastructure.
This is really a challenge. I have seen, like, mostly adoption of new technologies is always even it's a bigger challenge than constructing some facilities.
Yes,
I have
that's
seen
an easy part,
excellence.
relatively. So changing the mindset is a big challenge. So we worked on all aspects of blood banking, which included policy work, legislation, blood safety legislation, and then promoting voluntary blood donations, hemovigilance, laboratory practices, training of personnel, leadership trainings. So there's a whole lot of canvas that we had to work on, and we involved all the national stakeholders in the public sector and the private sectors, and also a lot of experts, foreign experts funded by the Germans and the WHO, would come from time to time and work with the relevant national experts to prepare the national partners to be able to run the new infrastructure when it is ready in a few years' time. So this was the phase 1 work, and we completed that very successfully. And I must say that before this program was launched, blood transfusion was not considered a proper specialty in the country. Everyone was working in isolation because the system was fragmented,
Right.
and the experts working in the blood banks, they had not even interacted with their fellow experts in other blood banks, even within the same city. But this program Safe Blood Transfusion Program. This provided the opportunity for encouraging interaction between the experts, which included doctors, technicians, paramedics, nursing staff. Everyone was provided opportunity at different levels. And all over the country, we had our seminars, workshops, national consultations. And so gradually, the Safe Blood Transfusion Program, and in this time, we also got opportunity to visit other countries, to attend conferences, seminars. We would present our work, and we would also get invited to share our experiences. So over a period of time, very soon, actually, we became the Safe Blood Transfusion Program became the national voice of blood safety and national platform of blood safety.
Right.
So that anything to do with blood transfusion, the federal government would approach the program, even for thalassemia sector, hepatitis spread, AIDS spread, and anything to do with blood banking, the government would seek our advice. And similarly, WHO and other international partners, they would also approach us for any information that they wanted from Pakistan, and they would they started recognizing very early on SBTP as the national voice of blood safety in Pakistan. So they would ask us to represent Pakistan on any forum and event that they were organizing.
So there's really excellent story and excellent journey and excellent work that you have done. I know you since that when you were like leading that program, and that was like I used to see you like traveling to different centers, and that was also a motivation for us, that how you are trying to convince the people that we should adopt the new technologies and we should train them so we can have like better things in Pakistan. So what is like before talking about thalassemia and other infectious diseases, I think we should know what is the current status of the facilities that you have developed and what they are doing right now and what impact they have created so far.
Right. During my tenure, which was from 2010 till 2020, I had the honor and privilege of leading this program for 10 years as the pioneer manager of this very enterprising program. We completed the first phase of the project, in which we developed all these regional blood centers and hospital-based blood banks, and also the technical work. And then based on the excellent performance in the phase one, the Germans committed to phase two of the program also, in which we developed more infrastructure and further strengthened the gains and achievements of the phase one. And so when I left the program in 2020, phase two was nearing completion. And after I left the program, that infrastructure was also finally completed. But it was really unfortunate that even after almost 5 years now, the Health Ministry has yet to appoint my permanent successor. So that was very sad, that the reforms process that we had initiated and the work which had been done couldn't be sustained the way it should have been.
Right.
But it's not as if everything just stopped. What happened was that the growth of the program and the reforms was interrupted.
Right.
I hope they appoint someone suitable soon who can take it up from where we left 5 years ago. But the good thing is that the infrastructure that was developed, that is still functioning. And that is really making a huge change in the lives of the patients, because the services they are receiving from these new infrastructure, that is really making a huge impact.
So you also served as a manager for the AIDS control program, the National AIDS Control Program. So what we have seen over the years, and there are also like some cases from city to city, they are often in the news because recently we have seen one case in Multan in one of the hospital, and there were also cases like in Sargodha, one of like case that was also reported. So in all these cases, so what's your take? Like, what is the current status of AIDS control program in Pakistan, and is it improving, and what is like need to do more in our country? Because what we have seen over the years, the cases are on the increase, and this is one of the disease which is like there is yet not a cure for this disease. So what do you say about this?
Yeah, it's unfortunate. It's a sad story. Until 2011, AIDS program was doing very well.
Right.
And main reason was that it was functioning under the Federal Health Ministry. But in 2011, health sector was devolved, and they just abolished the health ministry, and many programs suffered. Some of them could not survive. Blood transfusion program, fortunately, we managed to survive, and not only survive but also keep on implementation in the provinces. But one of the programs that suffered immensely was the AIDS control program. And it has still not, I've had the opportunity recently of doing some consultancy work with the AIDS control program, and I'm very sorry to say that in the rest of the world, HIV epidemic is under control. Even in Africa, it is well under control in most of the countries.
Yeah.
Unfortunately, in Pakistan, we can't say the same, and we regularly have reports in the media where there are outbreaks, and in Punjab and also Sindh, and every time there is news of this detection of cases, even and especially among small children, it's very surprising to see that these children, both the parents are HIV negative,
Yes.
but the children are HIV positive, and invariably in all the cases, there are two major drivers of these outbreaks. One is contaminated blood transfusion,
Right.
And the second is reuse of syringes by especially the general practitioners. Unfortunately, the HIV policy and the strategy does not take into consideration. So these are infections happening in the general population. Unfortunately, the HIV policy and strategy is still focused on the high-risk groups, which include injecting drug users, sex workers, and transgenders, and that kind of population, high-risk population. But they are not covering the general population, whereas the current outbreaks are coming up in the general population. So we need to focus on stopping transmission of HIV through strengthening of the blood transfusion system and preventing the general practitioners from reusing syringes, basically promoting auto-destructible syringes.
So, Dr. Saab, can you please explain us and enlighten us about the thalassemia program? Because in that program, we have to go for repeated blood transfusion. So, in that case, how we can ensure the safety of the patient? Because in that case, often we have seen that those patients who are receiving the blood, after a few years, they are suffering with hepatitis or they are suffering with HIV. So, in that case,
Yeah,
what do you say
very
about
good
that?
question again. Thalassemia is a genetic blood disorder. It's a preventable disorder. Unfortunately, in Pakistan, it is not being prevented. In the rest of the world, it is being prevented. And you have examples of countries which had a much higher burden of disease compared to Pakistan.
Right.
And there, for the last many, many years, there have been no new thalassemia major birth. For example, Iran, Italy, Cyprus,
Right.
Greece, Turkey, no new births. And the reason is that they have excellent public health program about thalassemia prevention and care, and the government is fully committed, and they have accordingly allocated sufficient resources, and their policy and strategy is absolutely correct. On the other hand, in Pakistan, we have no program for prevention and care of thalassemia at the federal level. Only in Punjab there is a program which has done very good work, but that work has been interrupted off and on. Fortunately, currently it is still on. in the on mode.
Right.
But we need to have a national policy and strategy about how to fix the thalassemia situation in the country, because we have a very high burden of disease, and we don't even know exactly how big the burden is,
Right.
because there is no national level data in the country. So first of all, we have to estimate or actually assess the burden of disease, find the number of people affected by this disease, and that should not be a problem, because if you have thalassemia major and you have to survive, in order to survive, you have to have regular blood transfusion every 2, 3, 4 weeks. So all you need to do is develop a system of counting the number of thalassemia major patients who go to the blood banks for their transfusions. And Punjab Thalassemia Prevention Program has actually done that and made an electronic medical registry, and they came up with a figure which tells you that the burden of disease is actually less than what is assumed. And normally everyone would say that there are 100,000 thalassemia major patients in the country, and this number is being increased by 5 to 7,000 new thalassemia births every year. So if that was the case, by now the thalassemia major patients would have outnumbered the population of the country.
Right.
So that is not the case. And for the first time, when in Punjab, the number of people suffering from thalassemia major was calculated, they found about 18,000 people, and this was about 5-6 years back. So now, if there are 20, 22, 23,000, and if you extrapolate, and if the burden of disease is the same in the rest of the country, at maximum you would have about 40,000 people. So this is much less. But 40,000 is still one too many. This is a preventable disorder. We should prevent it. And the dynamics of thalassemia epidemic in the country is different from the rest of the world. But there are still a lot of things that we can learn from their thalassemia programs. But we should not blindly replicate what other countries have done, because they have, for example, in Pakistan, the thalassemia gene is not randomly distributed. It is present in the affected communities and families only.
Right.
So when you hear the national leadership and even the experts calling for mandatory premarital screening for thalassemia, this makes no sense.
Okay.
It is crazy, actually. How can you screen 250 million people who want to get married? There is no need for mass screening.
I think recently they were I have seen in assembly, they also passed a bill in KP and also in Punjab that before marriage you have to screen for it, and your take is we should go for only those families which have gene pool, and we should screen them, because instead that's also put the burden on the couples who are going to marry, that they have to go for the screening. And
I mean, how can you expect the government to get involved in these marital affairs? I mean, as it is, it's complicated sector in Pakistan, and you don't need the government to make an entry in this sector and make it further complicated. It will give rise to stigma, discrimination, and besides, you don't have the resources to do credible screening. You need the proper labs, proper equipment, trained personnel, funding, and you need to designate the labs which the results of which lab would be acceptable. You don't have any of that. So if you really implement mandatory premarital screening legislation, all you are doing is giving rise to corruption. And even then, thalassemia would not be controlled. So the thing to do is just focus on the affected families, and these families come to you repeatedly for transfusion in the blood banking system. And so what needs to be done is to screen, do extended family screening of these patients. And if you find thalassemia trait in the family, those family members should be provided genetic counseling,
Right.
and they should be made aware of what they should be doing. You should not be stopping two people who have thalassemia trait from getting married. All you need to do is provide them counseling, and then you also need to develop facilities for antenatal screening, and you have this technology of chorionic villi sampling. In the first trimester, you can actually do an invasive test and find out whether the fetus, which is under gestation, is thalassemia major or not. And if it is, then you can offer them termination of pregnancy. It is allowed by religion also in Islam, and other Islamic countries are also doing it. So this is what needs to be done. It's very simple, but you need to have clarity on that.
So you have just mentioned another very important, that the countries like just you have mentioned about Iran, Cyprus, and Italy, that they have prevented the new cases of thalassemia. So what was like the key thing they have done, and that should also be done in Pakistan? One of the things you have mentioned is like screening of those people. What else we can do?
Basically, what these countries did was they took very good care of the existing thalassemia major patients.
Right.
Because thalassemia spreads from the affected patients. So if you take good care of them, then you can do prevention also. Prevention of spread of thalassemia would be part of their treatment and care. So, about 30 years ago, 25 years ago, thalassemia was considered as a childhood fatal disease all over the world.
Right.
But because of this strong political commitment and effective public health programs in all these other countries, thalassemia is no more considered as a fatal disease. It is considered as a chronic disorder requiring multidisciplinary care.
Right.
So thalassemia major patients in those countries live normal life. And they are productive members of the society.
Right.
Some of them make a lot of money. I know thalassemia major patients in other countries who are loaded and doing excellent work and very energetic, and you wouldn't even know them. You wouldn't even know that they are receiving regular blood transfusion, chelation, and all these other things,
Right.
if someone had not told you. On the other hand, in Pakistan, thalassemia is not a childhood fatal disease anymore, but it is from childhood it is graduated to teen levels. So most of our patients don't make it beyond teens or early 20s. And even during that time, they are miserable. They receive blood transfusion, which is not very easy and not very safe also. But the other aspects of the treatment, which includes especially chelation therapy, which is elimination of excess iron as a result of repeated transfusion, that is not taken care of properly. And as you grow, you require proper management of your cardiac system, endocrine system, your bones, your dental issues, and so many other things. That is not happening in Pakistan. So you can recognize a thalassemia major patient from, 20 feet
from a
away.
distance, yeah.
And this is very sad. The typical features would be stunted growth, typical thalassemia features, dark complexion, miserable, toxic
That's
looking.
true.
That is not the case in the other countries. In the other countries, these patients are the same as diabetes patients or hypertension patients, where you would meet them and you would not know they are suffering from diabetes, provided they are properly managed.
Definitely. So another very important aspect that we wanted to listen from you is about the growing cases of infectious disease, because we are running short of time as well, so we have to quickly discuss these important things. So in Pakistan, unfortunately, we are now number one in HCV cases, around 8.5%. It's 8.5 million, I think, cases of HCV in Pakistan. We have a very high number of HBV patients, and we have recently talked about HIV. So we have a growing number of HIV in Pakistan. So what is the role of safe blood transfusion in these diseases, and also so another statistics we often quote in our discussion is that in Pakistan we have the highest number of injections like anywhere in the world. We have a like huge number of injecting drug users and others. So in all these scenarios, like it's not only limited to blood transfusion. So if like we combine with the injection users and injection drug users, so what do you like, what do you say about the scenario and how we can overcome this challenge?
Yeah, again, there is scientific evidence available that contaminated blood transfusion and reuse of syringes,
Right.
they are the main drivers of HIV epidemic and also hepatitis C. For hepatitis B, we have a preventive vaccine, so
Right.
that is reasonably under control. But we also see, because of these contaminated transfusion, syphilis and other sexually transmitted infections. So what we need to do is strengthen the gains and achievements of the blood transfusion program, and that has been in existence for 10 years very successfully. Now it is interrupted as far as the continuation of reforms is concerned. But as far as the new infrastructure developed is concerned, that is working out very well, and especially in Punjab and Sindh.
Right.
Because once the infrastructure was developed, it was handed over to the provincial governments for operationalization. That was the original program design,
Right.
that infrastructure development and associated technical work would be funded by the donor funds, and the recurrent cost of managing this infrastructure would be borne by the respective provincial and federal governments.
Right.
So that is happening, that has turned out very well, especially in Punjab and Sindh, where the provincial governments have decided to outsource the functioning of these regional blood centers and hospital blood banks to the credible partners in the private sector. Which include Indus Hospital and Fatmi, basically. And I'm again very fortunate that I have the opportunity of visiting these centers regularly as part of medical audit of these centers. And I'm very happy and satisfied and pleased to share with you that these centers are working as per any international standards.
Right.
And these are in remote places like Jamshoro, Bawalpur, Multan, big city, but relatively remote. South Punjab is remote, and Sakhar and Nawab Shah. So these centers are doing great work. What we need to do, and they are also preventing all these infections and also providing safe blood and benefiting the people. What we need to do is to expand the size and scope of services of these existing centers, because they are still operating below their actual capacity.
Right.
So we need, what the provincial governments need to do is link more hospitals to these regional blood centers. And for example, the two regional blood centers, one in Bhalpur and Multan, they have the capacity or the potential to provide coverage to the entire South Punjab.
Wow.
So that
Excellent.
is 3 or 400 million people.
Right.
So that would be great. Similarly, the blood centers in Sindh, they can cover the entire rural or interior Sindh, as we call it. And if we build more these regional blood centers, we can provide universal coverage in the country. Unfortunately, the German partners have left the program. And this is also very sad. And they left the program because no one asked them to stay on.
But this program is like the infrastructure is there. I think now
Yes.
the government should put like
Yes.
more funding, and they can like
Absolutely.
join hand with other international organization to smoothly running it. So we are like running short of time. We are very much thankful to Professor Dr. Zaheer Abbas for joining us today in the studio. At the end, we request you, because overall, if we see the health system of Pakistan in number, if we compare like with the international, often we see that Pakistan is standing at 135th position, and if like we take around 200 countries, we are standing after 150 countries in healthcare, overall healthcare condition in the country. So we are like that much behind, and there is much more to discuss. Like with your expertise, I think we need to discuss more about the other preventable diseases that we can prevent in Pakistan, and also the role of private sector, because mostly like a 60% is the private sector now for the healthcare in our country. So like taking in consideration all these facts, so what is like your message for our listeners, that how we can improve the overall healthcare infrastructure, not only for the like listeners but also for the policymakers, how we can improve the things?
I think prioritizing or reprioritizing blood safety would help us in achieving many sustainable development goals, SDGs.
Right.
And these include, like infant mortality rate, it is totally unacceptable, very, very high in the country. Infections rate, preventable infections rate, very high in the country. So if you can just, because I am a blood person, so I would speak with reference to the blood sector. So if we can continue paying attention and prioritizing the blood sector, we can fix a lot of public health issues in the country. Unfortunately, many of the infections which are spreading in the country are spreading through the health sector, like HIV, hepatitis B, C, syphilis, and so many other STIs. So we need to decrease the number of people falling sick. And unfortunately, many of them are falling sick because of their interaction with the health system in the country.
Right. That's
so,
but
if we can pay attention to the preventive aspect, unfortunately, our main focus or the government's main focus is on the tertiary care.
Right.
You can't fix that without fixing the or stopping or reducing the inflow of the patients to these tertiary care facilities, because they are simply overwhelmed by the increasing numbers which are going there.
Okay, thank you very much once again, Professor Zaheer Abbas, for joining us today. Once again, Hassan Abbas Zaheer, and we'll definitely request you once again, because there are more topics to discuss, and your presence will be very valuable for our listeners and our community, that they should have understanding, and also for the policymakers, because there are, just like you have mentioned about the thalassemia program, that how we can improve the situation in a very less costly way. So these things are needed to discuss, and we request you once again for joining us in the future. And thank you once again for joining us today in the studio.
It was a pleasure.